Yes. So part of the crucial observations and from a public health domain is, of course, still the ongoing challenges of long-term care facility outbreaks, which is why I think all the chief medical officers, all the provinces and territories are trying to do um, the best they can to strengthen the response in that area because that is driving the severe outcomes, I think, in Canada. So I think that is absolutely a key feature of this epidemic. We have seen that the day-over-day increase in number of cases has slowed down, but we will be doing more work on that front, being cautious about where we're at, and so expect more um, essentially description of how that is going as we go along in the next coming week. I think a lot of the trends are actually positive in terms of the slowing down of that growth rate. I think one area that people did sort of note is the case fatality ratio or rate. And unfortunately, given the outbreaks in long-term care facilities, we will expect to see more reported deaths as the days go on. And if people are looking at that ratio of deaths over the total number of cases reported, even as I said in my opening remarks, even as the numbers of cases, that growth in the number of cases slows down, the number of deaths, unfortunately, are expected to increase. So that ratio is a very dynamic one that we're monitoring. But for sure, the key observation is still that the severe outcomes are impacting those who are of the older age groups, particularly those over 70 in terms of hospitalizations and deaths. And that is the group where we really must protect in terms of seeing a reduction in our impact.
Mia, follow up?
Yeah, just sort of building on some of that long-term care concern that you mentioned. Can you give us some updated statistics on how many of the deaths and cases that you talked about earlier today really are, we know were in long-term care facilities? And why did we not do more a month ago to set in place these kinds of guidelines when we saw outbreaks in long-term care homes immediately when this started to show up in Canada?
So in terms of the cases where we have the data on the whether someone was in the long-term care facility or seniors residents, we know that close to half of the deaths that we're tracking are linked to long-term care facilities. But that ratio is actually different in different provinces as well. So that's where we're tracking at the moment on that. I think that in terms of the long-term care facilities, all the provinces and territories have tried very hard. As you can sort of recall, some of the initial outbreaks started in British Columbia and then, of course, impacting all the larger provinces. And as all the health system, the public health officials are trying to strengthen their response, there was lessons learned and some of the key observations that were then built into these interim guidance. And I stress interim only because most of our guidance need to be updated on an ongoing basis. So this one, we will have to sort of look at that as we go along. But it's a sort of collective wisdom, if you like, from our experts that work in long-term care, infection control expertise, as well as what the provinces have had to work through and in the last weeks.